Tell me a little bit more about what you do after the surgery and how the recuperation would work with your practice and,
Sure.
and people that I'd be seeing.
So with the partial knee replacement or the Makoplasty, the recovery is typically 24 to 36 hours inpatient. We give 24 hours of antibiotics to prevent infection.
Okay.
We make sure pain is controlled, and by the time the patient's leaving, they're transitioned over to oral medications. We make sure that they're able to get in and out of bed safely by themselves. We train them on the appropriate use of a walker at first. They graduate over to crutches, then they graduate to a cane, and then by 3 weeks they usually don't require any type of an assistive device. Their pain medication requirements are typically gone by about 4 weeks. We can arrange for therapy to come to where they're living or staying, to begin physical therapy as an outpatient. If necessary, we can arrange for nursing to come to where they're living or staying. They are basically, if we get done early enough in the day, they're already beginning their therapy program by that afternoon. And it's a graduated program focusing on range of motion, strengthening, and conditioning, getting them back to an active lifestyle, getting them back to where they need to be to return to occupational function and sports.
Anything I should be aware of before the surgery? Anything that I should avoid doing, or in getting prepared for surgery? What should I consider?
Well, typically we send the patients to their primary physician, their internist or family practice doctor, for a checkup to make sure that they're healthy enough for surgery and healthy enough for anesthesia. Make sure their heart and lungs are working appropriately, check out some basic laboratory tests to make sure that their vital organs are working appropriately. And the majority of patients who are candidates for the partial knee replacement, this is really not a problem. This can all be taken care of where they live. We will fax out information of what is required by myself and by the anesthesiologist. And we get all of the preoperative arrangements taken care of before the patient travels.
Okay.